Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. wildhealth.com for all the information on becoming a patient or working with us.
Hey everybody, welcome back to the Wild Health Podcast. I'm here today with some new people on the podcast. First of all, I've got Trey Tackett, who is our lead health coach here at Wild Health. Trey is a nurse practitioner and has been with us from the very beginning at Wild Health, and he's going to be helping us talk with two very interesting people, Megan Hearn-Payton and Hayes Payton, who are the owners and lead directors of Fulfilled Life Counseling in Asheville, North Carolina. The reason that we have Megan and Hayes on the podcast today is because they're going to be talking with us about neurofeedback, which personally, I have to admit, is something I have very little knowledge of, but am very interested in based on the little bit that I've heard. So I'm really excited to have you guys on the podcast today and I guess educate myself and our listeners about neurofeedback. Welcome.
Thank you. We're glad to be here.
Thank you.
So I guess maybe a good place to start would be, I'm always interested in people's personal motivation into why they get into these sort of things. And I'm interested in why you guys personally got interested in neurofeedback in the first place.
Sure. Well, I love answering this question. Neurofeedback it's a career change for me. My background was originally in biology and environmental advocacy. And I've also done a lot of science teaching in addition to river conservation. And so with all of that work, my goal was to give people better information so they could make better decisions about the environment and about education. And what I found was, after doing quite a few years of that, was that that people generally weren't making better decisions, in my opinion. And it was, I found it to be frustrating to advocate for more clean water funding with Congress, for example, and that sort of thing. Like, the behavior change was slow to justify changes. And so when it came time for me in my personal life to change out of the environmental world, I was looking for something else that was science-based, but that would help people make better decisions with the information that they had available to them. And so at that time, I just started hearing some stories about friends and family who had done neurofeedback and had had life-changing improvements with things like, behavior struggles or getting over a traumatic brain injury and that sort of thing. So I started looking into it and decided to go that route. So I got educated in neurofeedback. And so what I love about it is that it's a very fundamental way on an individual level to help a person be more regulated so that they can be the best person they can be and then make better decisions.
Okay, awesome.
And I got into it because Megan introduced me to it. I've been a psychotherapist for 30 years, and I'm always looking for new tools to help people in their desire for change and to live more fulfilled lives. And I have a mind that I like computers. I like stereo systems back in the day. So this sort of fell in with that part of me. And I'm impressed with some of the changes that we've gotten in our practice through doing psychotherapy and neurofeedback combined.
When I hear you guys talk about neurofeedback, it reminds me so much of just this concept of kind of mindfulness. So maybe we should, I guess, define what neurofeedback is, and maybe if you could just kind of give us like the Wikipedia version of what we're talking about, it might help me sort of separate the concept of neurofeedback from just mindfulness meditation. if we could do that maybe.
Sure. So neurofeedback is a way to train your brain to work more efficiently without medication. So it is a way to regulate your nervous system so that your brain is not working too hard or working too slow. And it just helps your overall arousal level. And we use that word to be related to the arousal model of just, are you too ramped up? Can you not turn your brain off when it's time to go to sleep? Or are you heading on the depression side of things and not able to, put enough oomph into your decisions, or, motivate to do what you need to do. So we're just trying to encourage your brain to make better, efficient electricity. So your brain's got two languages that it works in, basically. So the electrical signals and neurotransmitters. And so this is working with the electrical signals. So what happens with it is that we listen in to your brain's electricity with sensors that we place on the scalp, and that gives us a live electroencephalogram called an EEG. And so with that live readout of the brain's electricity, then it goes through an amplifier, because it's very tiny signal. And so to make it big enough for the computer to work with it, and then the software for neurofeedback chooses whether your brain is meeting the goals that we are setting for it with the neurofeedback training, sort of like hurdles and limbo bars that is set up for each personal experience. And so then the computer gives feedback with audio and visual feedback through a computer screen. And so there's no electricity going back into your brain. With the neurofeedback training, it is just your brain has neuroplasticity and will autocorrect when given the right kind of immediate feedback, and it works with just audio visual. So that can be the screen getting brighter if you're watching a movie through the system, or it can be if you're watching a video game, the game is going to go faster, you're going to get more points. And then the audio feedback is to hear some beeps, or the music will get louder or softer and that sort of thing. And so as long as the client has the intention that they're going to just stick with it and receive that feedback and allow their brain to learn subconsciously how to regulate itself, then the brain just does that. It's not a conscious learning process. And so that's kind of the short version. Do you want to add to that? Okay.
That's really interesting. It sounds like geeky exercise for your brain, which is kind of awesome.
Yeah.
It's like it's exercise in the sense that it's really basic, and you're just sort of doing this thing, kind of over and over again and getting direct feedback. But it's kind of geeky because you're wearing all these electrodes and there's all this tech involved. But it sounds really awesome. Trey, one of the reasons I wanted you on this podcast is not just for your good looks and your sultry voice, but also you've gone through the process and you've done this with Megan and Hayes. So I'm curious, from your perspective as a student, what does this look like? What was the experience like?
Yeah, thanks, Mike. It's a really interesting process. So I came to it with some moderate exposure level, and I kind of understood the process. I always in my mind compared it to Pavlov's dog with positive feedback, the bell and the food and the mouthwatering thing. But I really didn't understand until I went through it, exactly how it worked and what it would feel like. And it's somewhat difficult to describe, but the system that we're using currently is MindLift, using a Muse device and an electrode, which is determined by the provider, in this case, Megan and Hayes, what area of the brain you need to train for what symptoms you're experiencing and what your brain map looks like. So you get your map. You talk to Megan, or you provide a survey to your provider. And based on that, you're able the neurofeedback provider is able to, I guess, prescribe, for lack of a better term, a regimen for your brain. And in my case, Megan and I were focusing on reducing high beta. I'm pretty on most of the time during the day, speaking with clients or working on projects, and I have a young child. And so when I get home, it's kind of hard to shut down in the evenings. And by reducing high beta frequency, I was able to find a noticeable difference in my mindset whenever I was in the correct range. And I was able to repeat that even when I wasn't practicing neurofeedback with the device and the positive feedback system. So it essentially strengthened my ability to meditate. And I was able to find that place again with or without the device after some training. And it was a really nice experience.
So you're saying you're actually creating presence in your regular life without using the tool now at a better level or at a higher level than you were previously.
Yeah, and I've heard some other people describe that. Megan, I think you call it after the first training session, some people experience what's like a clear glass effect. It's a very, very calming sense of clarity and ease of thought without brain fog. And I'm not saying that's going to occur for everyone that tries it, but I could feel kind of what an optimal brain state felt like. And I wasn't able to stay in it all the time, but I was able to get back to it when I felt myself getting a little bit one way or the other.
That's great, Trey. I'm so glad to hear that more about that experience in that way. That's great. And that is one of the hopes, that people feel more clarity, less brain fog. They're better able to sleep, better able to switch gears between tasks and, let work go when it's time to go home and spend time with your kids and that sort of thing. So yeah, it just helps all of your brain waves get into a better balance. And so some of us kind of have our foot on the accelerator too much or our foot on the brake, or some people have a foot on the brake and the accelerator at the same time, which is a problem. So we try to get the brain to learn how to be more flexible with all of that and adapt to all the changing circumstances throughout the day. And like Trey was saying, you don't have to do my neurofeedback training all the time, 24/7. It's kind of like a yoga class for your brain. So doing a yoga class a few times a week is going to improve your flexibility and your strength and your calmness and all of that. So that's sort of a good analogy, I think.
Yeah, it kind of sounds like maybe the neurofeedback is the clutch and you're changing gears, just to continue with the car analogy that you were using. So I understand that there's a Muse device on the head, which if people don't know what that is, they can easily Google a Muse device. It's basically this meditation device is how it was initially created, but it's got some electrodes on it that basically give you feedback during meditation. And then there's an additional electrode you guys are using, as well as, are the people on their phone or on a computer screen? How are they getting the feedback? Is there an app?
Yes, there is an app. The MindLift app is, you can look at it on your phone or on a tablet. We try to encourage tablets if possible, because the bigger screen is kind of better feedback. But so the client is wearing the Muse headband, which has sensors picking up their EEG. And then through the app, we as the clinical providers can see that from wherever we are remotely. And look at the sessions in retrospect and so forth. But that the app will give them immediate feedback through the audiovisual cues that they're looking at on their phone or tablet. So they can play a video game, they can look at YouTube videos, they can listen to music or whatever they want to do, but the app will work with those different types of media to give feedback to the brain. And then, like I said before, the brain just subconsciously learns because it sort of wants to see the movie in full color or wants to get more points on the game and that sort of thing. So there is some inherent motivation and intention necessary for doing it. But that's all there is to it. It's pretty simple. The additional electrode that plugs into the Muse is what turns it into a neurofeedback device instead of just a meditation device. And then, of course, the MindLift app is a critical piece.
I just got actually the equipment from you in the mail yesterday, which I've looked at. It looks basically like a Muse with just a little attachment to it, which I have some experience with, which is great. So I'm really excited to get started and start using it. We've started offering this for our Wild Health patients, and I know Trey has been sort of leading the charge on that. Maybe if you could just give us some examples of types of people that this is great for, or maybe some stories of people who've had good experiences, just so we can better understand from a real life perspective when neurofeedback might make sense for someone.
Sure. People who are struggling with anxiety or attention disorders, attention deficit, are great candidates for this. People with PTSD and depression. And if you have sleep problems, this can help with that too. But we find that some of our clients have had really good experiences solving anxiety problems. There was one of our clients that comes to mind who she talked really fast, had very pressured speech, and she was constantly like arguing with herself in her head and totally worried about all these relationships and things at work. And she was just kind of very much stuck on high speed worry and couldn't relax that. And just after 1 or 2 neurofeedback sessions, she came in and it's like, wow, I feel calm. I'm not having this constant dialogue in my head all the time. I'm getting along better with my roommate, and, I'm not worried about work so much. I mean, it was really pretty dramatic. And then another one of our clients who has a lot of hypervigilance and actually has some developmental trauma as well. He has been able to really kind of feel some distance from that hypervigilance and anxiety. And so he's much more calm and has now some space between before he responds to stimuli in his environment. Instead of just being super reactive all the time, he now has the regulation in his nervous system to pause and decide how he's going to proceed. And so that's been a big factor in his life. And then one other I'll just mention is a teenager who has had a lot of trouble with attention deficit. After doing neurofeedback with her, she said that it was easier for her to pay attention at school, and she was actually taking notes for the first time, and able to be present instead of just having her mind pull her in 10 different directions all the time.
And for myself, I used to have the afternoon doldrums, or kind of like lunch bonk with my attention and brain fogginess, and pretty much a lot of days at 2 or 3 p.m. And through neurofeedback, I don't have that syndrome anymore, and super happy about it.
And the winter blues too, right?
And it's helped with some of my winter kind of depression syndrome.
Mm-hmm. Yeah, and for my own experience, I do it too, and give it to my kids as well. It just helps me with more clarity and in thinking, and more motivation and better sleep, and helps my kids with anxiety. This spring, with all of the pandemic adjustments with school and social changes and everything, my kids have definitely had some ramping up of anxiety, and it really helps them to calm down and kind of give them sort of a release from the pressure of the anxiety, and so they can be cheerful and play like normal again. So that works well.
Super helpful.
And that's pretty amazing. All of the different varieties. Are there people that that shouldn't avoid it, or it would be contraindicated in use for certain scenarios or diagnosis for individuals?
Well, that's a good question. So, and that kind of will necessitate explaining a little bit how MindLift neurofeedback works and how it's different from traditional neurofeedback that you would do on a desktop computer in a clinician's office. So the benefits of MindLift are that you can do it remotely and you can do it on your own schedule. You can train yourself as often as you want to instead of having to have 1 or 2 sessions a week at an office. However, the limitation with it is that you only can train with 1 electrode, and it's only what's called single channel. You can have neurofeedback training up to 2 channels or 4 channels. There are even people who do 19 channel, which just means that you're giving your brain feedback based on that many more locations in your brain. So your brain has different lobes, different tasks are driven by activities in different parts of your brain. So we do change the placement of the electrode depending on the person's clinical history and their symptoms. But with MindLift, we just have the 1 electrode. So things like developmental trauma or people with concussion history, we have to be more cautious about that because it limits the range of protocols that we can use safely. So, and we would not train anyone with seizures with MindLift neurofeedback or epilepsy. Those can be treated with in-office neurofeedback. And in fact, some of the earliest research on neurofeedback back in the 60s was about seizure disorders. But with MindLift, we need, sticking with anxiety, depression, ADHD, sleep issues. Those are kind of the main things that we feel really good about how well MindLift does with those.
Performance.
Performance. Oh my gosh, I totally forgot that.
that falls in with the attention, where to having the ability to choose where you place your attention, and the clutch in position of the alpha brain waves allows you to shift gears, and that's the main thing that people work with for performance with neurofeedback, is that switching gears up and down, calmness to very focused and aroused.
We try to be as much as we can data driven on Wild Health, and it sounds like there's been lots of clinical experience here just on this call of people who've had great outcomes with neurofeedback. But is there any research that shows that this is beneficial in pathologic conditions or even in optimization?
Yes, there has been a lot of research since the mid-60s. So it's definitely not a new technology. It's been evolving since then. And, but yeah, great research results on those 4 categories that we mentioned: anxiety, depression, ADHD, sleep, and also PTSD has got a lot of great research supporting the efficacy of neurofeedback. Let's see, what should we, and there was a great article that we used about seizure disorder being improved, and it's kind of combined with performance too. It was a great, it wasn't like a broad study, but it was a deep case study. Yeah. That was just really impressive. But there are quite a few big studies. It's hard to do double blind with neurofeedback, but it's a little harder than like with medication, but it has been done with ADHD and PTSD particularly. And so, yeah, robust research.
But not maybe as much of the super double blind, because there's not a lot of money to being offered to it, because it's not a pharmaceutical. The pharmaceutical companies can't benefit from selling it.
Right.
So there's been a lot of studies of like applying it, by practitioners, not by maybe certainly some research, quite a bit of research, but not as much as maybe the field needs in the direction, but certainly lots of research to support.
Any idea on efficacy, like what percentage of people we would expect to have benefit? Say if you take like ADHD or anxiety or one of these pathologic conditions, is it like 10% have benefit? Is it a 50%? Is it a 80? Broad ranges there.
Ooh, yeah, I don't know if I could speak to that percentage number exactly. So I think it has, there's a fair amount of individual variability.
Sure.
With the success of it. And also when I say too, it's not something that you can do in total isolation and have expected to work. So neurofeedback, one of the benefits is that it helps make it easier for you to make good lifestyle choices, but also you need to be making good lifestyle choices in conjunction with it for it to really work optimally. And so if you're doing neurofeedback for anxiety, for example, and you're continuing to be in a very high stress job and your marriage is on the rocks and you have special needs kids and, you never sleep and all of that stuff, and that doesn't change, you can't necessarily surmount that with neurofeedback by itself. So that's why it's hard to say exactly a percentage of efficacy because it kind of depends on the holistic picture of what's going on for a person, which is one of the things we really love about Wild Health is that it is a comprehensive, holistic health improvement system. It's the whole thing, which is great.
Right. Sometimes we do like these studies of N of 1 where we only change one thing for a patient, but that typically only lasts for a couple of weeks before there's something else to change. So I totally get that. And, one thing, the way I approach treatments like neurofeedback, where maybe there's not, the robust randomized, placebo-controlled, double-blinded studies, is sort of this concept of, all right, what's risk versus benefit? It sounds like here the benefit is quite high, and from what I'm hearing from you guys, the risk is quite low. Would you agree with that?
I would totally agree with that. There are virtually no side effects from neurofeedback, and if there were to be something, it's kind of like on the level of you might get a headache for a little while, you might feel more tired for a little while. Sometimes you might feel like your symptoms are a little bit exaggerated for a short time, but I'm talking about like a day or two. And also that can be adjusted. You can adjust the protocol with your clinician to compensate for that. So it's really very low risk. And the great thing about it too is that you're just offering your brain a learning opportunity. You're not forcing it. So that makes it work better. If it's gonna work, it's gonna work well and last for a long, long time because your brain is learning a new way to function.
I got to say, I'm really excited about it. I am a little curious how long are these sessions that I'm going to be doing, and how long should I expect to be going through this process? Is this something that are we talking about like, a couple of months? Are we talking about years? I guess there's probably variability from person to person. What's your experience?
Sure, that's a great question. We find that kind of a very minimum number of sessions would be 20, but we really encourage folks to do at least 40 sessions. And those sessions take about 20 minutes each on average. And so you can do it multiple times a week. So in that scenario, you could get 40 sessions in 2 or 3 months if you were devoted to it. But if you're only going to do once a week at an office, it could take a year or longer. We do see in our office, we see like that there's something shifts around 15 or 20 sessions typically in a person's brain, and we can actually measure that in our assessments to see that the amplitudes of the brain waves that we're looking at and encouraging them to adjust up or down, those change over time. And so we track progress both objectively through those amplitudes of the brainwave frequencies, and also it's really important to us to hear the subjective reports from clients themselves. Do they feel better? Are they sleeping better? Do they feel like they can shift gears better? Because there's an art to it. It's not just straight science and numbers. And so sometimes we'll have a session with a client and the numbers are not trending at all one way or the other, but they feel awesome at the end of it. Like you take off the electrodes and it's only been 20 minutes and it doesn't really look like anything has been happening, but they're like, I feel so relaxed and I just feel really clear and motivated to do the next thing that's going to help my life get on the right track. And so that's really encouraging. So it's we have to look at both things. And so it's important to get enough sessions in order to see some trends in the numbers. So I'd say, 40 is a ballpark number of sessions.
40 20-minute sessions is around 14 hours of work, which isn't a lot.
Really, it's not compared to a lot of things you could choose to invest in.
Yeah. I mean, I immediately go to, okay, how long does it take someone to get to this point with mindfulness meditation? And I definitely believe it's greater than 14 hours. So this is really intriguing as sort of like a fast track to that same level of presence and clarity and relaxation. Yeah.
Yeah. I've heard people call neurofeedback meditation on steroids.
Right. Yeah. I wonder if in 14 hours, could I just take a Saturday off and just do this straight through?
That's a great question. You could. I wouldn't recommend that. I think it's better, kind of to put an analogy to, like, if you were trying to increase your muscular strength and you wanted better abs, and instead of doing 20 sit-ups every day for 3 months, you just did sit-ups all day for 1 day, that would not get you the same results.
Give me some pretty serious DOMs afterwards too.
Sorry that you did that.
I won't be able to get out of bed for the next few days.
A little bit, every day or every couple days is a way better plan, because your brain gets tired, depending on the protocol that a client is doing. It can feel a little bit fatiguing because your brain's trying to figure out a new way to function. So doing a little bit at a time is best.
I'm always interested when I talk to people who are experts in the field, what they're interested in the future of that field. So what interests or excites you about this at-home neurofeedback coming in the future?
I'm excited we'll just have tech sort of throw some research and some money at this to have more robust remote, home systems that have multiple electrodes and the ability for a remote clinician to, do the more complicated protocols that are 2-channel or 4-channel, and just to see where this leads. There's definitely a lot more interest coming into it, even just with the Muse headband, a lot more people knowing about that. So that's something I'm interested in.
Yeah, I think that there's so much potential for improvement in the way in people's personal lives and then the way that they interact in the world. And if they're more regulated, that can only be a good thing. And so to have this become even more affordable in the future, I mean, the cost is coming down significantly from what it was even 10 years ago, but having really good, remote systems, and MindLift is doing a great job of constantly adapting and improving what they offer. And an example of that is that they have just released kind of a beta version of not exactly a brain map, but getting at some of the assessment pieces that we can do with a brain map in the office, that people can do at home, and then the clinician can look at it elsewhere. So that's great. There's still, work to be done to make that even more helpful and robust, but that is definitely the right direction, and we're excited about that.
Is there a way for you to quantify the quality of someone's brain map? I'm thinking specifically about whether I can talk Matt Dawson into doing this as well and then compete with him on who has a better brain map.
I think that's a really good idea. Well, yeah, I mean, if you were going to get like a full-on brain map, it would need to be in an office, and it's called a QEEG, a qualitative EEG, or quantitative, I'm sorry. And so that would measure your brain activity at 19 places around your head all at the same time. You'd be wearing like a swim cap looking thing that's full of wires. And so the benefit of that is that you'd be able to see more about the interactions of the activities in different parts of your brain, and what the symmetry was between right and left hemisphere, and what kind of the communication networks were looking like. And so how well your brain was functioning in a deeper level beyond what just the amplitudes of brainwaves at a certain spot on your scalp are. So what we can do with with MindLift at the moment is just to kind of take a snapshot view of those amplitudes. So those are, but the great thing is that with MindLift, it's very inexpensive compared to what you would get with a QEEG in an office.
No, so I'm taking that as a yes. Yes, I can compete with Matt. Okay.
Yeah, I'm for compete with Matt and see what you can go.
I'm gonna referee this competition for you and Matt.
You're gonna referee it? Okay.
I'll be the judge of who wins, so we can keep this a series.
Right, I like this. Great. Well, I want to respect your guys' time. I really appreciate you coming on the podcast, talking with us about neurofeedback. I've learned quite a bit about your process, and I'm really excited to try this device out. I've got 14 hours tomorrow. I'm just going to get after it. We're going to see how it goes. And I'll probably be back on the podcast in 3 months once my brain neurons recover. So thank you guys. Thanks, Megan. Thanks Hayes, for coming on the podcast. Trey, thank you for jumping in and giving us your feedback as well.
Thank you so much. We enjoyed it.
Thanks, everybody.
All right.
Thanks for listening to the Wild Health Podcast. If you found it helpful, give us a 5-star rating and write a review on iTunes. It really helps the podcast, and we greatly appreciate it. If you want to be a client or you want to work with us, go to wildhealth.com. Thanks again.